This is Lauren Dunlap, Executive Director for Advocacy and Awareness for Immune Disorders Association, or AAIDA, in Charlotte, North Carolina, and I'm excited to host AAIDA's third educational webinar for 2022 this afternoon in sunny Charlotte, North Carolina. AAIDA's mission is to provide support and advocate for the greater than 25 million Americans living with immune disorders. AAIDA works to promote research and create better awareness for immune disorders. I would like to take time to introduce nurse practitioner Archie Sims, who will be discussing urgent care versus ER, what to know and when to go. Archie Sims is originally from Florence, South Carolina, and moved to Charlotte, North Carolina in the fall of 2019. Archie has been a licensed family nurse practitioner, or FNP, since 2017, initially working as a hospitalist in Sumter, South Carolina, before transitioning to retail health in 2018. Prior to obtaining his FNP at Francis Marion University, Archie worked in the medical ICU and on the ICU float team in Florence. While at Francis Marion University, he enjoyed teaching clinicals to the undergraduate nursing students and participating in research opportunities. Archie has also worked in the home health setting since 2020 and administering IVIG and subcutaneous IG to patients. This has given him a new appreciation for those living with and in immune-compromised conditions. Since working in retail health, Archie realized many people aren't fully aware of their options when it comes to acute medical care. He hopes to address this and give people a better understanding of where to go when they have an urgent medical need versus one that maybe can go to, the urgent care. So Archie, thank you so much for joining us. And I'm actually really excited to hear about this topic this afternoon.
Thanks. All right. Well, I'm actually really excited to do it. Like you said, I think it's definitely a need.
For sure.
All right. So, kind of like Lauren said, what to know, where to go. Let's get this thing started. All right. So it can be difficult to navigate the healthcare landscape these days with so many options for medical treatment. This is made worse when you or a loved one is sick and there's little time to look up what services are provided at which level of care. Even though I've worked in most levels of care, I still have a tough time determining where to go when my wife is sick or falls and breaks her foot. Again, seems like it happens, every other year. All right, so to start with, let's discuss the different levels of care. Typically, when we talk about level of care, we're referring to primary, secondary, and tertiary care. But when I say level of care in this context, I'm referring to a very basic and broad term relating to the type of healthcare needs of a person, what type of healthcare facility you should visit, mainly emergency room, urgent care, retail health. All right, so let's get started with the big bad emergency room. So here's the basics. As the name implies, the emergency room is for emergencies and significant urgent situations that need surgical or interventional treatments. Many times, these are life-threatening conditions. Sure, you can visit an ER for more mundane reasons, but it'll cost you a lot more than utilizing a lower level of care. All right, so pros and cons of the ER. First and foremost, it can save your life. ERs have access to any and all resources you may need for any medical conditions. And if they don't, if you're in one of those small, rural hospitals, they can stabilize you and get you to another hospital that does. So that's, ultra convenient. And the cons, long wait times for non-emergent conditions. And then costs, I think we all know ERs can be super expensive. Could be anywhere from, $500 to many thousands of dollars, just depending on, what condition and what you need. All right, urgent cares. So there's a huge variability between urgent cares. I did a quick Google search. It shows some locations have the ability to X-ray where others don't. Several can do EKGs, others can't. Some can even do basic imaging and ultrasound. Listen, it can be super stressful and frustrating, trying to find the right facility. My best advice for determining, which facility to visit in regards to urgent cares is just call. Call and ask them if they provide what you need, if you know what that is. And what I mean by that is, if you fell and you think, oh my God, like I really think, I broke my arm. Well, that's a reasonable thing to call, an urgent care and say, hey, do you guys do X-rays? It's just so much quicker than getting there, signing in, waiting, and then being told, oh yeah, we actually don't do that. You could also visit their website. They've got a search. Most have a search bar. You search their services. Honestly, whenever I went through, and even, where I work now, I'll jump on a website to help patients, and just navigating, their websites, just not super user friendly. It's just quicker and easier to call. If you're anything like my wife, she does not like to call and talk to people, but
When
is what it is.
Archie, just right quick on the slide that you were just on, when you were talking about the huge variability between urgent cares, are you referring to the services or the companies that run these urgent cares, or maybe it's both? I know there's so many companies that they're popping up left and right, kind of like Dollar Generals are these days with an urgent cares, because people want to also avoid the ED and the ER because of the high deductible and copay associated with those visits now. So I was
Right.
just curious as to see when you were doing your research on this topic, what that may have looked like, especially since you currently work in a larger urgent care company, and what are
Right.
the smaller guys looking like?
Yeah, no, I mean, honestly, it's both. I guess I was technically talking about services, but no, you're right. Like even, I mean, gosh, I, you know, smaller, like you said, smaller urgent care companies, those are likely not going to have your big ticket items as far as, X-rays, ultrasounds, things like that. But your big, corporations that are, and I mean, that's becoming a lot more common, your Atriums, your Novants, your
Right.
McLeods, they're really, really picking it up. But if that's in a smaller city, it kind of goes back to it's still smaller urgent care. So there's variability even in the same company, which is
Mhm.
wild.
It is.
Wait, did that answer your question?
Yes,
I
thank
kind
you.
of answered it. Okay.
That's okay.
All right, so let's talk about some pros and cons here. So pros, more flexible hours. Typically they have longer office hours, so you can make it, after work or on weekends. You don't need an appointment. Also, super convenient. It's cheaper than an ER visit. So an estimate by debt.org showed that $18 billion could be saved by Americans by going to an urgent care or other level of care rather than the emergency room. Dude, that's a lot of money. Um, and the other nice thing, most procedures and visits are covered by insurance. So the average cost is $100 to $150. Now, there's an asterisk there. The cost certainly depends on your insurance carrier, but it's usually compared to a family doctor visit, like a primary care visit. So that's also a nice thing. Another pro, you'll be seen quicker than in an ER. The average wait time for an emergency room is between 4 to 6 hours, and that could be a low estimate.
I was gonna say that's probably pretty low on the ED and ER,
Yeah,
depending on what your situation is. If it's not urgent, you might be there all day.
exactly. Um, so location is also a big pro for many people. Urgent cares were originally created to provide greater access to care for people. Um, there are typically a greater number of these clinics located in convenient locations like strip malls, near highways, and easy to get places. Um, you know, quite a few pros. Here's definitely comes with some cons here. They don't care for life-threatening conditions. Uh, like we talked about earlier, just the differences and variability in diagnostic equipment. I mean, that's kind of big. And then another thing, they likely won't have your health history or family history, although, if that can be alleviated with a longer intake to obtain history. But, as someone who works in that environment, it's tough to kind of take that extra time sometimes. But and also some electronic health records are starting to communicate with each other. So if your family physician utilizes one of these, history will transfer over, and you don't have to worry about that particular issue. So I'm seeing that more and more, which is super convenient. I get a new patient and I can just click on, it automatically pops up on our electronic medical record, and I know it's just a lot easier. It's a lot better. All right, retail health clinics. A lot of information. This is a lot, much newer thing. Retail health clinics are a fairly new option for medical care that popped up about 15 years ago. These are super convenient when you use it appropriately. They're mainly staffed by nurse practitioners and physician's assistants, which are the non-physician providers. Preferences for and against them vary. Quick, sidebar here. I had a professor in grad school that would make a point to correct anyone who would call non-physician providers mid-level providers. Her reasoning was, we don't provide mid-level care. So it's actually interesting though, because her sentiment is echoed in multiple studies over the past 40 years, where they've shown consistent patient outcomes and satisfaction with non-physician providers being comparable to that of physicians. So that's pretty cool.
A lot of people don't know, Archie, that, physician assistants really work underneath the physician that they work around. And that's where they learn everything, is from that physician. Nurse practitioners are a little different than physician assistants. Obviously, they have, different educational backgrounds, but a lot similar, where a nurse practitioner doesn't necessarily have to work underneath a physician this day and age, where that wasn't necessarily the case, a few years ago. But
Right.
this is still a little confusing to me, the retail clinics versus the urgent care, because I'll kind of like, okay, that's the same thing, but it's really not. And I'm guessing that's because of just mainly services provided, more or less, in broader terms.
Yeah.
Gotcha.
Yeah, exactly. And kind of in that same vein, these are places that are in pharmacies or, big corporations. So they tend to also follow pretty strict guidelines. And that's another thing that, you only have so much wiggle room.
hmm So with the urgent care, there has to be a MD or DO on staff, where the retail clinics don't necessarily have to have an MD or DO.
Correct.
Gotcha.
So, like you said, there will always be an MD or a DO on site at an urgent care, whereas you will never have an MD or DO at a retail health clinic at all. Like we have collaborating physicians we can call or contact if we have a question, but I mean, it's just it's just me in that chair, it's very much just that nurse practitioner or PA.
That's interesting. Thanks for
Yep.
clarifying that.
Yeah. All right. Pros and cons of retail health. So normally retail clinics, like we, kind of talked about just a second ago, they're located inside or nearby pharmacies and typically open 7 days a week. The price still cheaper than emergency room, and in some cases it may be cheaper than urgent care, kind of based on insurance and services you need done. The other thing I really like about retail health clinics is most of them have transparent pricing. You can just go online and it will tell you exactly what each service cost, and that's cash price. So if you don't have insurance, or you don't want to use insurance, or you just want a brief idea, quick idea of what it's going to cost, you can look at that, and it's super transparent, even to the point where strep tests, flu tests, things like that are on there. So I like to be informed, and I like other people to be informed, and I feel like that's a nice thing. But also, like I said, it depends on insurance, because insurance covers a lot of these things. So you might see $139, but then when insurance runs, it's just your copay.
Well, it's nice to have the transparency, available
Yeah,
online, because a lot of times the cash price is actually cheaper than what the insurance may charge you. Maybe for an injection, they may want to charge you $200, but the cash price, and you can see it online for yourself, might be $113. So I think that's really
exactly.
nice
No
and
matter
convenient.
what. Yep. No matter what, this is what it's going to cost. If, like you said, if insurance, says nope, it's more. No, it's only going to be what this is. So that's kind of nice. Just like urgent care, no appointment. You don't need one. Uh, Another little asterisk there, and I should have mentioned it with the urgent care. COVID had really messed this up. I mean, we're finally getting back to no appointments needed, but there in the height of it, it was very much, well, you need to sign up online. But now we're back to kind of business as usual, just walk-ins. I had to throw that in there. Let's see. Oh man, I think I'm missing a page.
Uh,
Not really.
that was
I don't know.
actually one of the questions I had later, was about how this kind of shifted during the pandemic and between the retail and the urgent care.
Yeah, it gosh, it really was, appointments only, and it was really confusing to patients. So like, I get it. It's super frustrating. But also like kind of one of those things.
Right.
I guess my dog ate that paper. Anyway, so
Literally, Zeus ate the paper, not
yeah,
not the homework, but the presentation paper. Nice.
yeah, of course.
That's okay. Well, we can manage without it. You do this every day.
Yeah, yeah. So cons, more limited service. Kind of like we were talking about. Little to no blood work, labs, definitely no imaging. We do basic testing, flu, strep, some minor like cholesterol screenings, but that's really it. So super limited service list. So this is kind of the meat and potatoes of, all right, if I have these symptoms, where do I go? Urgent care and retail health for minor illnesses and injuries. A good way to think of it is, do you feel comfortable going to your family doctor? If you do, go to an urgent care. And even retail health for most of those as well includes symptoms and things like seasonal allergies, flu and cold symptoms, UTIs, fevers less than 103, nausea, vomiting, diarrhea without blood, earaches, minor sprains, strains. It's, again, I like the analogy of, if you would feel comfortable calling your family doc up, then you could probably go to one of these. Now ER, kind of like we talked about, it's definitely best to utilize that just for life-threatening illnesses and conditions, that require surgery. That's difficulty breathing, chest pain, left-sided arm or jaw pain, seizures, fever with a rash, head or eye injuries. Now that includes concussions, large cuts to your face, and then signs of stroke. Think, fast face, so one-sided facial droop, arms, raise your arms as one, drift down, speech, any slurred, strange speech, and then time. If you see any of that, call now. Go now. Get to the ER as fast as possible. Ultimately, though, at the end of the day, trust your gut. If you've got a mild fever and a little cough, and it just doesn't seem right, and you feel like maybe I need to go, just go. It is better to be safe than sorry. If you've got that gut feeling, just get to the emergency room, because there's, it's kind of that mom sense, if you've got that, just, it's better for you, I think. Now, what to expect? I kind of did a little something different. I feel like I've got a form at the end of this that I'll pull up once we get done talking, but I really like it. I think it'll really help you and the whatever location you go to, just speed things up and make it much easier for both parties involved. So photo ID, that's kind of a general thing. Yeah, your driver's license, state ID, even a passport. Insurance cards, medical insurance cards are the absolute minimum. If you have supplemental coverage, it's, definitely want to bring that too. All right, legal documents. All right, so this one's a little broad. Think your healthcare power of attorney, living will, advanced directives. That's more geared toward if you're going to an emergency room, because if you're needing these, you probably don't need to be in an urgent care. And that's, advanced directives, things like that. That's just in case you're incapacitated and you can't make your healthcare decisions for yourself, and you've got that on paper, what you'd like or who you'd like it to make those decisions. So list of current meds and supplements. That's where the list that I'll pull up comes in handy. It's one of those things you should be updated frequently, and just keep it in your wallet or your purse at all times. I recommend updating it at least every time you go to your family doctor's appointment, or whenever a medication gets changed. If your handwriting is as bad as mine, you might want to type it out and print it, as that's a much better option.
Just out of curiosity, Archie, the company that you work for and the clinic that you work for, a lot of larger healthcare facilities are going toward the Epic platform, and that's really handy with the electronic medical record, and having all this information in it. But that's not always an option or available for either the patient on their phones or computers, whatever, or the facility doesn't have it available. So I was wondering, since yours is a larger company, is that something that y'all have? Is the Epic system and able to pull this type of information when a patient comes in?
Yes, we do. Actually, we use Epic, funny enough. So what I've found is it's great for, the information that it pulls over is it's nice that you can get the like the visit notes from previous, providers. You pull it up, see it, awesome. I see what you got. The issue is that doesn't always necessarily transfer over to my chart, that I have open that I want to do. So I'm still having to go, back and forth and kind of update it. Or so the medications will pull over, but
And they
those
pull
are
everything, even if you're not haven't been on them in 5 years.
exactly. That's the problem. Is I'll see, gosh, do you take these 25 medicines? Like, no, probably not. So that's kind of goes back to it's so much easier when I get a patient that just hands me their paper and it's like, yep, this is what I take. Oh, thank God. Like I can just type it in real quick, go through, and that makes things much easier. Because if there's something they do take that's not on that list, it's tough for patients sometimes to verbalize that. Whether it be that they can't quite say the name, or they don't know the name, or they don't know the dose. There's just a lot of other things that are with that you really need, because that's important. Those are important things. Actually, that was my next point. Actually, make sure you have your, that information on there.
Right.
But yeah, so we could have a whole other thing with Epic or electronic health records. But yes,
maybe that's another
right.
topic: electronic health records and how to navigate those for patients, because they can be very tricky to navigate and just a black hole of time if you don't know what to do or what to look for in various ones as well. So, but we won't go down that rabbit hole today.
No, but you're right. Like that's exactly right. All right, let's see where we at. Oh, allergy list. So again, I would just put that on the paper, get it with your med list. It probably goes without saying, but that prevents providers from prescribing anything that may be fatal to you. Brief medical history, it's another thing you want to have. Any medical conditions and important surgeries on this list. So by important surgeries, I mean anything that a provider should know that could influence their plan of care for you. So if you had your wisdom teeth taken out 30 years ago, honestly, I don't care about that. That's not going to be super relevant for what we're doing here. But if you had a heart valve replacement or something like that, I definitely want to know that. Again, seems excessive, but it can make treating you so much easier to know up front. And again, I would just throw that on that same paper, and it's a good to have. Emergency contact information, another thing in that vein, just stick it on there, especially if you're in an ER and you can't verbalize anything or communicate. At least we have someone we can call to get some information, if you have that on there. And then providers and specialists contact information, gosh, especially you get in a car accident and kind of if you have an immunocompromising condition, it would be super convenient to know that whenever you get brought in, to have, hey, this is your doc, we can just give them a call, make sure it would just help. It's super helpful. All right, so let me pull up this form here, because I looked at a bunch of different forms, and the AARP one was my favorite one. That one. So it's nice because it really does just have everything and makes it very user friendly.
It's a nice breakdown. And you said that's on the AARP website?
It is. I've got the link at the end as well.
Okay.
This is my favorite page. The medication. That just so easy. Just so nice. I'm telling
Nice
you.
and clean, yeah. Easy to use.
Yes. But yeah, I'll have that. You can, and it'll let you type in it, or you can print it off, handwrite it, however you want to do it. All right. So this is just a quick recap of what we've been talking about. Kind of going back with the what to expect. Each visit to every level of healthcare will be different, but there are they share a few similarities. They all need to see your ID, run insurance, collect copays, all three assess, diagnose, treat you for whatever you come in with. You know, how's going to be the difference. What you present with, that's going to be why. Retail health, urgent care, generally much quicker. Visits typically don't take longer than 30 minutes. Obviously that's dependent on your wait time, but even wait times not too bad in these settings. ERs, again, renowned for long wait times, but if your condition warrants emergency medical condition, you'll be seen immediately. So that's also the nice thing, is if you need the care now, you get the care now. So I definitely wouldn't go to the emergency room for a stubbed toe, but certainly if you're having severe chest pain and shortness of breath, you're going to get seen when you need it.
Probably pretty timely, I might add too. More than likely. You're having those
Yes,
type of symptoms.
exactly. You will go to the front of the line. This bottom part right here, that's the PDF for that AARP. Again, I'm a fan of that specific one, but I mean, you can handwrite all that stuff too if you have a better way.
Well, we're recording this, so that's another thing, is when I process this video later tonight or tomorrow, I'll have it posted on the AAIDA website as well as the AAIDA YouTube, and they can go back and look at the actual, if they don't want to write it today. So that works
Right.
too. You can look at the recording.
Yeah. All right, Q's and A's.
All right, I'm going to open it up here. Just reminder to our audience that you can type in questions in the little box over there. I know I had one question, Archie. You said, depending on the facility, you have limited labs available that you can. Well, this is actually a two-part question. Limited lab services available in the retail health setting. So what does that mean exactly? Are they generally limited to maybe doing a CBC in a retail setting, or what does that kind of look like?
Yeah. Good question. So that's, so we can send things off in retail and do basic CBC, BMP, thyroid panel, cholesterol, lipid,
COVID testing. COVID testing.
Oh God, yes. Oh God, absolutely. Yes, COVID testing. The other thing is, we do have some point of care testing too that most have, and that's just a really quick down and dirty cholesterol and lipid screen and blood sugar. And what I mean by that, it's a finger stick, and you get the results within 15 minutes. A1C, and that's really it. I mean, that's all the labs that we can do. So pretty limited in that sense.
That was interesting, because I would have never thought of that. I mean, as limited services in the labs department, but do most urgent cares have their own labs in house, or do they generally go outside and have various companies, couriers come and pick them up and drop off.
Oof. I really think most of them have couriers,
Mhm.
unless it's like an urgent care attached to like a freestanding ER. 'Cause sometimes they'll kind of share that, and they'll have like basic like Kim equipment. So again, CBC, BMPs. I don't think they do anything crazier than that fast, like in-house. I want to say most of them they use a courier, like they just send off labs. Um, yeah, I'm trying to think off the top of my head. I mean, so I guess there are a few that do have in-house, but not many. It kind of goes back to it depends on how big,
Right.
if it's a big player, company that owns it, and it's a large facility that can house that.
I didn't know this until I've been to a couple of different urgent cares. Not very familiar with the retail clinic side of things, but in regards to urgent care, I've been in a couple in different states. Like there was a couple, two different companies in Colorado, different years, and then there was another one here in Charlotte, that I had to visit, and it was very interesting, the experiences at all of them. But um, the one that I got bit by a dog a few years ago, and it drew blood, so I had to go to the urgent care to get it wiped, make sure it got checked out, cleaned out, all that fun stuff. They had all the equipment um, there to do everything. The other one, it was a different year, was more simplified, totally separate companies also in Colorado. Well, one, and then there was another, and they could not do, like you suggested, x-rays, some of the labs, et cetera, et cetera. I had to go to a totally different facility. And then there was one, 4 years ago, I fell and cut my arm pretty bad. I had to go to the ED, actually, and get
Oof.
a lot of sutures. But I thought that maybe this might be something you want to add into this is, when it was time to get my sutures removed, that's when I could go to an urgent care, instead of having to go back to the ED where I originally got them, right? And I never really would have thought about that if somebody had at the time suggested that to me. I was like, oh, I have to
Yeah.
go to the same place that I got them because that's where I got them, right? But that's not necessarily the case. So
Right.
um,
Yeah.
that was just
Yeah.
a
No,
little
absolutely.
thing I thought of when you were going over all this. So if you wanted to add any of that, it's stuff like, okay, in the moment, it was an emergency, right? So I had to
Right.
go to the emergency room so I didn't, bleed out. But on the follow-up care, that's when patients could potentially go to a lower level, um,
Yeah.
service area. And I don't know, I think insurance wise, they would cover you because that's where you got the original, care is at the emergency department. They're going to take your stitches out and not charge you another copay. But,
Right.
you know, they have to by law because they've already rendered those services and they're not allowed to charge you again. But if you're in a hurry, because you're not going to be at the top of the totem pole in the emergency room to get sutures removed. If you were in a
Right.
hurry, I feel like, that might be a time you want to go to an urgent care. Or do they do sutures or remove sutures at, the Minute Clinic or retail clinics
Yeah.
rather? They do?
Yeah. No, great call. Yeah, I should have put that in there. Yeah, and I can tell you it would be a lot cheaper to go to one of those retail health clinics to get that done. One, it's going to be a lot quicker, and it'll be a lot easier and a lot cheaper.
Right, right. Um, are there any other questions from our audience members? From Archie? Well, kind of a quiet audience today, but all right. Well, Archie, thank you so much for being with us this afternoon and volunteering your time to educate our community on this topic. And of course, thank you to our audience for being present during this afternoon's presentation. Please do take a few minutes to fill out our quick survey after the conclusion of today's presentation to help us better serve our community. And also, if you enjoyed our presentation, please consider making a tax-deductible donation to AIDA on our website at www.godoaida.org. I almost said .com. Sorry. And again, this is Lauren Dunlap with Archie Sims, nurse practitioner and for Advocacy and Awareness for Immune Disorders Association. And we hope you have a fantastic afternoon. Thanks so much for joining us.
Thank you.
Thank you.